Hello, Dr. Ferguson coming to you from the Passioncam. Going to continue on this kind of student-parent kind of relationship. And I was just thinking about, so often I get young ladies in the office that are very, very young, maybe 12, 13 years old, 14 years old, and they may be pregnant. Well, how does that happen? Well, part of what happens is the foundation hasn't been established. Maybe no one has told that young lady how pretty and wonderful they are enough times. Maybe they haven't told her how wonderful her body is and how she needs to protect it. I don't know what the foundation or why that happens, but we know when it happens, it's a problem. You have children raising children. I can remember when I was a medical student, one of the first babies I delivered was a 14-year-old girl. And I said, who's going to take care of the baby? She says, my mama. So again, children raising children, and why do they do that? They see these things on television, they hear about these things, they hear what's happening at school. You're square if you haven't started having sex when you're in elementary school these days. I mean, it used to be middle school. I don't know what the age limit is now, but I know it's getting lower and lower. But this is where the parents come in and having that relationship with your children, both the men and the women, because each of you are going to come from a different perspective. The father's going to have one perspective, the mother's going to have one perspective. And when you put those two perspectives together, you come up with a good package. So I just encourage you it might be an uncomfortable topic for you to talk about. Those conversations need to be had. You can't just ignore them and rake them under the couch and under the seat and just think they're not going to exist. Kids are going to get their sex education from somewhere, from the television, from the streets. They're going to get it from somewhere. Now, you have to decide where you want them to get it from. So you can't get so religious and so pompous and that you don't want to have that topic because it can't happen. It does happen. It happens every day of the week. It happens with preachers' kids. It happens with ministers' kids, doctors' kids. Doesn't matter what your background is. It happens. And so you have to make a stand and decide that you want to teach the kids the proper way to do this, when's the proper time, what they should be doing, how they should be doing it, as opposed to letting them learn it from the streets. And maybe you don't know it so well yourself. There's plenty of books on the topics. There's plenty of internet things you can go and research and evaluate and get some new information on how to share this topic with your children. I'm sure there's tons of books on how to talk to your children about sex education, whether it be elementary school or middle school or high school or even young adults. They need the conversation too. And even if you're getting ready to get married, everybody needs to know this information. And it's used at different times. It's used appropriately at the appropriate time, hopefully. But don't not give the information because you don't think it's going to happen. Because it will happen. They will get the information from somewhere. And you have to take the time and share it. So on that note, Dr. Ferguson coming to you from the Passioncam. Be blessed and have a wonderful day. Bye-bye.